Hello, this is Dr. Gay from First Look MRI, and this is a 29-year-old female who has left knee pain for about 3 years. They did an x-ray and they noticed that there was a lytic bone lesion down here. This is the left tibia. This is the upper diaphysis, or the upper shaft here. We see a lesion with sclerotic margins and lucency centrally. Looks well defined, and the pain was a little bit below the knee, so they got the patient back and did an MRI to evaluate this. And this is a T1 weighted image where fat is bright. So we see high signal within the marrow, high signal in the subcutaneous soft tissues. Muscles are intermediate to low signal here. These are the calf muscles. This is the heel. This is the calcaneus back here. You can see the Achilles tendon just to get oriented. We see this lesion is in the proximal tibia, and it's not within the medullary cavity. It is associated with the bony cortex or periosteum here. You see the dark band is the cortex, and that's scalloped and pushed down, has sharply defined margins. This is a sagittal view looking in profile. This is an axial view, short axis going through the lesion. We see very well defined margins. You can see that it's expanding the cortex, and it has some scalloping of the cortex, but it does not go into the medullary cavity. We're going to put up another view here. This is a stir image, and on this view we see the lesion right here. We see it has some speckled areas of low signal on a background of bright signal. This is what we call a chondroid matrix. You can see the differences, like areas of low and bright signal. We think that it may have chondroid material within it, so we call this a chondroid matrix. Again, it has sharply defined margins, and the cortex is scalloped. You can see it looks like it arises from the cortex or the periosteum. Here we see the sagittal view in that mottled, characteristic, speckled chondroid matrix. We see the reactive marrow edema. There's brightness in the bone here, the medullary cavity, and that means that there's some reaction. This is expansile, putting pressure on here. We have reactive marrow edema, but there's no pathologic fracture. And we have one more set of images, and these are the fat-suppressed pre- and post-contrast images. This is before contrast. This is a T1 with fat suppression. So all the subcutaneous fat is dark. And we see here the lesion is fairly bright because of that chondroid matrix. And with contrast, there's a little bit of a contrast enhancement, but not really dramatic on this. You can see the vessels here, veins in the subcutaneous fat are a little bit brighter. On the post-contrast one, this is the gastrocnemius muscle, the medial, and you can see the vascular structures in there are much brighter, so you can tell this is one with contrast. So just mild enhancement. We can also appreciate the enhancement on this sagittal image here. There's the enhancing bone lesion, and there's the marrow enhancement underneath it. And we don't have pathology on this, so the diagnosis is uncertain, but just looking at this, we see the margins are very well defined. It's definitely associated with the bony cortex, not the medullary cavity. It's an expansile lesion, and it's not coming right out of the middle of the cortex or back. It's coming along the anterior aspect, like the surface or periosteum. So this may be a periosteal lesion or just a really superficial cortical lesion. And that chondroid matrix, the fact that it's coming off the anterior surface, probably periosteum, and the fact that it's been there for supposedly 3 years by clinical history, and that it has the fact that it has very sharply defined margins, makes us think that it may be a periosteal chondroma, which we also call a juxtacortical chondroma. And these bone lesions will have this chondroid matrix, well-defined margins, and again, they come off the anterior surface of the bone. And the problem is that a chondrosarcoma can produce an identical imaging appearance. You really have a hard time telling those apart just based on the imaging alone. Also, anytime we see an expansile bone lesion with scalloping of the bone or erosion of the bone that comes off the surface, we can also think about an osteosarcoma called surface osteosarcomas. There's several different varieties, but one of them is a parosteal osteosarcoma or a periosteal osteosarcoma, and they usually more irregular, more lobulated. On the X-ray or CT, we'll see much more bone density. This is more uniform, and it looks like a chondroid matrix, and it's very sharply defined. So the smooth margins argue against that. Plus on the X-ray, it didn't have really wild bone density that we might see with an osteosarcoma. Here, this is a lesion on the sagittal, or I'm sorry, lateral view of the tibia. This is it coming off the anterior cortex, and there is some increased bone density, but it's not really lobulated, prominent bone density like an osteosarcoma might be. So again, scalloping of the cortex, smooth margins, and we're hoping that this is a chondroma arising from the anterior periosteum called a juxtacortical chondroma. But they'll definitely need to do a biopsy and make sure that it's not an early chondrosarcoma or one of those other surface osteosarcomas. And that's it. Thank you very much.